Your doctor told you it's nerve damage. Take gabapentin before bed. That's not wrong, but it may be 20% of the real answer. Because the reason your feet specifically burn worse between midnight and 3 a.m. has everything to do with a hormone that hits rock bottom while you're sleeping. And once you understand this, the treatment picture really begins to change. After 35 years in practice, with the last several years dedicated entirely to patients with peripheral neuropathy, this is one of the most common questions I get. Why is the burning always worse at night? The short answer is nerve damage, but the complete answer is much more specific, and it changes how you approach treatment. In the next 12 minutes, I'm going to walk you through the circadian biology behind the nighttime flare, the 4 most common root causes behind burning feet, and why that distinction matters for how you actually address it. Let's get into it. That burning, that sensation, the one that wakes you up at 3 a.m., isn't random. There's a specific biological reason it peaks in that window, and most patients never have been told what that is. Your body runs on a 24-hour hormonal cycle. Everything from your blood pressure to your immune response to your pain perception follows this cycle, and it has direct consequences for neuropathy. Here's what happens as you move into the late night hours. Cortisol, your body's natural anti-inflammatory hormone, drops to its lowest point overnight. At the same time, the inflammatory cytokines, the chemical messengers that amplify pain signals, surge, and they peak right around midnight. The result is a body that is at that exact moment more inflamed and less able to dampen that inflammation than any other point during your waking hours. Here's a number worth knowing. 68% of patients with neuropathic pain report that symptoms are most intense between 11 p.m. and 3 a.m. That's not a coincidence. That's circadian biology. Now here's the second piece of this, and this one surprises most patients. Your body produces a natural pain modulator called Beta-Endorphin. Think of it as your internal volume control for pain signals. During the day, even with nerve damage, Beta-Endorphin is active. It's helping filter out some of the noise coming from those damaged nerve endings. At night, Beta-Endorphin also drops to its lowest production point, and it bottoms out right around the same time melatonin peaks, approximately 3 a.m. What does that mean practically? The same nerve signal that your brain was partially filtering out during the day now registers as intense burning. Research suggests pain perception can be amplified by 40% compared to your daytime baseline. The nerve damage has not gotten worse overnight. The environment the nerves are operating in has changed dramatically, though. And that changes everything about how the signal gets processed in your brain. There's one more piece of this. During the day, movement and activity create competing sensory inputs that naturally dampen the pain signals. When you're stationary and trying to sleep, those competing inputs disappear. The signal from your damaged nerves gets louder, not because it's stronger, but because everything else got quieter. So, circadian hormone shifts, the beta-endorphin dip, and the removal of daytime sensory competition. 3 reasons the timing is not random. 3 reasons your feet burn at night. That explains the timing, but it doesn't explain the source. Because here's something I see consistently in clinic. 2 patients, same symptom, burning feet at night, completely different causes driving it. And if you treat them the same way, you get very different results. This is where most neuropathy conversations really fall short. Not all burning feet are the same. The symptom is the same. The root cause driving it can vary in different ways, and that distinction matters for what you do about it. Root cause number 1, diabetic nerve damage. This is the most common cause that I see. High blood sugar over time changes the small blood vessels that feed your peripheral nerves. The nerves become starved of oxygen and nutrients. They begin to misfire. The burning, the tingling, that's damaged nerves sending chaotic signals. One thing worth knowing, though, neuropathy starts in the longest nerves first. That's why the feet almost always come before the hands. The nerves running to your feet are the longest in the body, and they're the first to feel the consequences of poor circulation and oxidative stress. Root cause number 2, B12 deficiency. This one gets missed far more often than it actually should. Vitamin B12 is essential for maintaining the myelin, that protective sheath around the nerve that protects the nerve fibers. Without adequate B12, myelin breaks down, and when the myelin breaks down, you get the same burning, tingling, and numbness that diabetic neuropathy produces. Who is most at risk? People on metformin for diabetes. Metformin is well documented to reduce B12 absorption over time. People on proton pump inhibitors for acid reflux, and anyone over 65 because B12 absorption naturally decreases with age. The important thing about B12 deficiency neuropathy, when it's caught early, it's highly reversible. That's different from most other forms of neuropathy. If B12 is the driver, addressing the deficiency directly can produce real improvements, not just symptomatic management. Root cause number 3, small fiber neuropathy. This one is frequently missed because the standard nerve test, the EMG, doesn't detect it. Small fiber neuropathy affects the tiniest nerve endings in your body in the surface of the skin. These are the fibers responsible for pain and temperature sensation. When they're damaged, you get burning, tingling, and significant pain with a completely normal EMG. Patients with small fiber neuropathy are often told that their tests are fine. They're not imagining it. The symptoms, their test just is designed to find a different kind of problem. The diagnosis typically requires a skin biopsy. Autoimmune conditions, genetic factors, and sometimes no identifiable cause can drive this. I do a dedicated video on small fiber neuropathy specifically. I'll link that below. Root cause number 4, idiopathic or multifactorial neuropathy. This is the category where patients have been told sometimes for years, we don't know why this is happening. Idiopathic means the cause hasn't been identified. What I want you to hear is this. That is not the same as saying there's nothing to do. In many of these cases, a combination of oxidative stress, metabolic insufficiency, and low-level immune activity is driving the nerve damage. The root cause may be harder to pin down cleanly, but there is still a biological picture to address. 4 different causes, same symptom, very different paths forward. If this is already giving you a different framework for thinking about your neuropathy, hit subscribe. I put out videos like this every month, and if you have a question about your specific situation, drop it in the comments. I actually read them. Gabapentin before bed is the default recommendation for nighttime burning. And I want to be clear about what it actually does because it does something real, and that's where it stops. Gabapentin works by reducing a nerve signal transmission. It binds to calcium channel subunits and essentially turns down the volume on the misfiring nerve signals. For many patients, that provides meaningful relief, and it's a legitimate tool. But here's what it doesn't do. It doesn't address the hormonal environment your nerves are operating in at night. The beta-endorphin dip, the cortisol drop, the surge in inflammatory cytokines. Gabapentin is not touching any of that. You're managing the signal, but the amplification system is still running. And it does nothing for the root cause driving the nerve damage itself. The diabetic vascular damage, the B12 deficiency, the oxidative stress, those are continuing in the background. This is why I tell patients gabapentin addresses the symptom. The root cause is a different conversation. So what does addressing the root causes actually look like? For B12 deficiency-driven neuropathies, B12 supplementation. This is one of the clearest cases in neuropathy treatment. Restore adequate B12 levels and the myelin can begin to recover. Patients often report improvement in burning and tingling over weeks to months. The timeline depends on how long the deficiency has been present, but the direction of the change is actually real. For diabetic neuropathy, 2 things matter. Alpha-lipoic acid, ALA as it's called, is an antioxidant that directly addresses the oxidative damage mechanism driving nerve deterioration in diabetic patients. The research on this is solid. A 12-month protocol combining alpha-lipoic acid with B12 and additional antioxidant support showed meaningful improvement, not just in pain scores, but in actual nerve conduction measurements. That's a different level of outcome than just symptom relief. The second piece for diabetic neuropathy is metabolic optimization. Blood sugar control changes the vascular environment your nerves are operating in. You can't address diabetic neuropathy with supplements alone if blood sugar is still damaging the nerve vessels that feed the nerves. For small fiber neuropathy, the approach depends on identifying whether there is an immune component, a genetic factor, or another driver. This is one of the reasons why a proper diagnostic workup actually matters. Treatment without a diagnosis is simply just a guess. What I want you to take from this section is a simple framework. Symptom management and root cause treatment are two different strategies. Both may be appropriate for where you are right now, but they produce different outcomes over time. One gives you relief tonight, the other changes the trajectory of the process. Let me bring this together with a practical framework, because this is what I actually want you to leave with. Nighttime burning is your nervous system sending a signal through a body that in its most pain amplified state. It's not imaginary. It's not random. It's biology. The timing tells you something. The same nerves that burn at night are being affected by the circadian hormonal cycle you can understand and potentially address. The root cause matters. B12 deficiency responds very differently than diabetic oxidative damage, which responds differently than small fiber neuropathy. The symptom is the same, the intervention is not. And here is the question I would encourage you to bring to whoever is managing your neuropathy. Have we identified what's driving the nerve damage? Not just what medication to take for the pain. That's the conversation that leads somewhere different. Burning feet at night is, again, your nervous system sending a signal through the body. At that exact moment, it's in most susceptible state to feel pain. So the gabapentin addresses the real signal. The root cause, obviously, is still different. And that's one worth having with your provider. If your feet are waking you up at 2 a.m., you deserve to know exactly why. 3 things to take with you. The nighttime peak is biological. Circadian hormone shifts can amplify pain perception by 40% after midnight. That's not nerve damage getting worse. That's the environment that your nerves are having to live in. Not all burning feet have the same cause. B12 deficiency, diabetic nerve damage, so small fiber neuropathy, each have different paths forward. The diagnosis actually matters. Symptom management and root cause treatments are 2 different strategies. Both may belong in your plan, but they produce very different results over time. If you want to understand the specific warning signs that your neuropathy may be advancing, I put together a full video on the 7 clinical signs I actually look for in clinic. That's worth watching next. I'll link it here. For those dealing with small fiber neuropathy specifically, the kind that shows up with a normal EMG, I covered that in also a separate video because it deserves its own explanation. If you're navigating neuropathy and you want to understand your treatment options beyond the standard approach, make sure you're subscribed. I cover these topics every month. That's it for today. I'll see you in the next one.